All right, Chapter 2, Relevant Theories and Therapies for Nursing Practice. So, psychological theories help us to explain behavior. Our treatments based on these theories, and an overview of theories and therapies and their relevance to nursing and psychiatric mental health nursing are described throughout this whole thing. So, here we go, starting with psychoanalytic theories. So we have Freud. Some people like Freud, some people do not. He's known as the father of psychoanalysis, so you might want to remember that. He said that there's these different levels of awareness, okay? So you can see over here on the right-hand side, we have Freud's view of the human mind, and it's done as an iceberg. So you have up here at the very top your conscious level. So this is your thoughts and your perceptions of things that you think and how you interpret stuff, and it's always right there, like it's always obtainable, just like how it is right here above the water. It's always right there. Then you have your pre-conscious. This is material that can be reached with a conscious effort, so memories and stored knowledge, so things that you've learned before would be in your pre-conscious level. So like when you take a test, you're able to pull up stuff that you had, or memories from when you were younger, you're able to pull up. And then your unconscious down here at the bottom level is repressed memories, things that are too painful to deal with, difficult to retrieve on your own. So if you look at the different things that are down there, that's going to be in your unconscious level of memories, and you that would be stuff that you would actually need like some kind of therapy many times in order to bring those back up. He also talks about the personality structure. So he has the id, the ego, and the superego. So the id is driving instincts. So you have a little baby over here to remember this, that it's the pleasure principle, the reflex action, and the primary process. Basically what that's saying is that the id is in control of what I need right now, please give it to me. So the baby needs to be fed, the baby needs to be changed, the baby needs to be held, the baby's crying, it needs something, and it needs to happen right now for the baby. The baby doesn't know how to say, I'll just wait a little bit and then it'll happen. So that's the id, what I need right now. The ego, it knows how to delay gratification. So the ego is a problem solver or a reality tester. So the guy over here is hungry, his stomach's growling, but he knows there's no food around here. I gotta wait till I get home. I gotta wait till I find a restaurant, some place to get a snack. Is able to say, okay, this cannot happen right now, but it needs to happen soon. And then the superego is our moral component of us. It's the should and the should nots. So this is what tells us basically right from wrong. It's doing the right thing. You know, we talked a little bit about integrity. Integrity is doing the right thing when nobody's looking, you know. So anyway, those are your three components of Freud's. Freud also talks about defense mechanisms and anxiety. He says these operate on an unconscious level. They deny, falsify, or distort reality to make it less threatening. Denial is huge for our patients, okay? But read that again. It's denying, falsifying, or distorting reality to make it less threatening. So this is a totally normal defense mechanism that almost everybody has, because we don't want to believe these bad things that are happening or these things that we're scared of. So this next one, it's just talking about like different things with our personality. Under here you have your transference, countertransference. I'm not going to ask about that kind of stuff, but it's there for your knowledge. He also does these stages of development. You want to know Table 2.1 on page 22. Make sure you go over that. He has the oral, the anal, the phallic, the latency, and the genital stages of development. So make sure you read through those and be aware of about where each one of those are happening. Erikson's ego theory, he has 8 stages of development and says personality continues to develop through old age. So this is a great one that we use. You have your trust versus mistrust, 0 to a year and a half, autonomy versus shame and doubt. So like going through each one of those as you read through those in the book, you know, if something hasn't happened early on, like trust versus mistrust, people are going to have problems working through the next roles, or further on down the line, like identity versus role confusion at ages 12 to 20, because their own identity they're trying to seek, but what's their role? Well, if they never learn to trust, it's going to be hard to determine what their role is. So all of these things, the trust needs to happen, but if it doesn't and mistrust happens, then you're going to be having a hard time working through all of those things. And then, as people continue and get older, intimacy versus isolation is 20 to 35. This is, did I find a partner? Am I close with people? Do I have a good social network? Intimacy does not have to be a husband and wife or a relationship or anything of that, like a relationship, a romantic relationship. I mean, you can be intimate with other people and it's not a romance. It's not a sexual thing. It's that I know somebody else intimately. Those of you who are parents, you know your child intimately because you know them inside and out. You know what they're like, you know their personality, you know what they like, what they dislike, all of that stuff. But the intimacy versus isolation can be romance or maybe not. It can be just having intimacy with other people, having a good social network versus being somebody who's totally isolated. So Erikson's theory in nursing development model is an important part of nursing assessment, helps determine what types of interventions are most likely to be effective. So again, you have this whole list right here. You'll see down here I changed the generivity versus self-absorption, and then ego integrity versus despair. You will want to know when about all these different things happen. So there you go, no table 2.2, page 23 for Erikson's. Sullivan's interpersonal theory, the purpose of all behavior is to get needs met through interpersonal interactions and to reduce or avoid anxiety. So you have anxiety as any painful feeling or emotion that arises from social insecurity or prevents biological needs from being met. And then security operations measures one employs to reduce anxiety and enhance security. The foundation of Hildegard Peplau's theory, remember Peplau, is actually based on Sullivan's theory. So she says that there's a participant observer, and the nurse interacts as an authentic human, respects the patient, has unconditional acceptance and empathy. Remember, empathy, not sympathy. So the nurse is a participant observer. We're watching and interacting at a human level. So the art of nursing for Peplau's theory of interpersonal relationships is to provide care, compassion, and advocacy, enhance comfort and well-being. The science of nursing, application of knowledge to understand a broad range of human problems and psychosocial phenomena, intervene in relieving patient suffering and promote growth, care for the person as well as the illness, think exclusively of patients as persons, because that's the way we want to be treated, right? We don't want to be looked at as a condition that's laying in a bed. We want to be looked at as the person in which we are. We want to be looked at on the whole, not on what we're just there going through. And as nurses, we need to make sure that we understand and treat the person as a whole, not as just their problem that they're going on. On page 25, this is a great quote. The nurse observes and listens to the patient, developing impressions about the meaning of the patient's situation. By employing this process, the nurse is able to view the patient as a unique individual. The nurse's inferences are then validated with the patient for accuracy. So that's us using that therapeutic communication and repeating what we think we heard and asking for clarification and all that stuff. If you have your patients become a person to you first versus a patient, you and the patient will have a much better outcome and shift for your shift, and you'll have an overall job satisfaction that many nurses do not have because they do not look at their patients as persons. Nurses are both participants and observers in therapeutic conversations, and self-awareness of the nurse is vital, keeping focus on patient and not meeting the needs of a nurse. So Peplau continued, she is known as the mother of psychiatric nursing. That's actually all I want you to pull from that slide. Behavior theories and therapies. So we have behavior theories that include Pavlov's classical conditioning. This is involuntary, not spontaneous. You may have read in the book about, this is about the dog who They ring the bell every time there's the treat, and then eventually when they ring the bell and there's no treat, the dog still salivates. Watson's behavioralism theory is controlling environment can mold the behavior. Skinner's operant conditioning therapy is positive and negative reinforcement. And the implications for nursing, we want to modify or replace behaviors and behavior management. So you can kind of go through these, look at systematic desensitization, exposing to distressing stimulus in stages. So the book talked about how the person doesn't want to fly on planes, they're scared. So they kept bringing the patient or the person back to the airport just to watch the planes land, and then, you know, stand closer to them, and then eventually going beyond one. And so it's just that taking them over and over to desensitize them to the thing that's distressing until they can do it. Aversion therapy, you're going to want to know that. This is in a form of a punishment. So in the last slides that you watched, if you've already watched the substance abuse, Antabuse is sort of an aversion therapy, right? Because I take the Antabuse, and then if I eventually drink on it, I'm going to get really sick. So there's going to be this major consequence to it. And then biofeedback is gaining conscious control over unconscious bodily functions. Cognitive theories and therapies. So you have your cognitive theory, the dynamic interplay between individuals and the environment. Thoughts come before feelings and actions, and thoughts about the world and our place in it are based on our own unique perspectives, which may or may not be based in reality. So we may work with a lot of patients where it is not based in reality. So if you see over here, you have your thoughts create feelings, your feelings create behavior, your behavior reinforces the thoughts, and it just keeps cycling around and around. You have rational emotive behavioral therapy. This aims to take away irrational beliefs, recognize thoughts that are not accurate. And then cognitive behavioral therapy, this is test distorted beliefs and change way of thinking to reduce the symptoms. So if you look on page 31, you'll have common cognitive distortions. These are going to be important for you to recognize. So cognitive distortions, meaning that that's not right. It's not. This is not rational. So if you look here, all or nothing thinking, either it's black or it's white. There is no in between. There is no gray. That's a distortion. Overgeneralization, all or nothing, saying like not all or nothing, saying all of those nursing instructors are mean. They're all mean. That's overgeneralization. Labeling, mental filter, disqualifying the positive. So yeah, I might have gotten an A on that test, but I got a C on that paper, so I'm not going to do well in this class. You know, disqualifying the positive that you got the A on the test. Jumping to conclusions. Well, if this is what's going on, then it's sure that this bad thing is going to happen. You know, jumping to conclusions and saying this is what's going to happen based on this, when there's no way to even know for sure that that's the case. So make sure you read up on cognitive distortions. Humanistic theories. So here's our Maslow's, one of my faves. Maslow's hierarchy of needs. So human beings are active participants in life, striving for self-actualization. When the lower needs are met, higher needs are able to emerge. So again, you've got your physical, your safety, your love and belonging, your esteem, and then your self-actualization. And it's a lifelong process working up this way, and we always are going back and forth, okay? Throughout life, we're going to be going back and forth in different things. The emphasis on human potential and the patient's strengths is the key for the nurse-patient relationship. So we want to look at what's the potential and what are the patient's strengths. Prioritizing nursing actions in the nurse-patient relationship. So an example would be getting pain relief and stable vital signs before attempting to collect background information. If I'm working in the ER and I got a patient in the room that's 10 out of 10 pain and they're hurting, am I going to be able to go sit down and talk to them about what brought them in and how their day was and what their history is? Absolutely not, because I have to meet those physical needs first before I can start working up the thing for Maslow's. Additional therapy, so we have milieu therapy. We've talked a little bit about the milieu, also known as a therapeutic community. This is use of the total environment I'm not going to get through all I did. Okay, well, anyway, go back to that last one. I messed that up. It's the people and the structure protecting safe and therapeutic environment.